Well, we know that many of our functional medicine clinicians have a personal story about how they came to functional medicine. And yours is a story that's pretty well known. But for those who may not be familiar, will you
Sure.
give us a recap of how you first came to research the impact that diet can have on our neurological health?
So quite a while ago, in 2000, my left leg grows weak, and I end up seeing my neurologist, who ultimately diagnoses me with relapsing remitting multiple sclerosis. I'm 45 years old. I find the best MS center in the country. I see their best physician take the newest drugs. And 3 years later, age 48, I'm in a tilt recline wheelchair. I take mitochondrial, a form of chemotherapy, then Tysabri, the new biologic, but I continue to decline. And that's when I start reading the basic science, and I decide that mitochondrial dysfunction is what's driving disability. I create a supplement cocktail for my mitochondria. It helps my fatigue a little bit, and I'm super grateful. I'm still declining. Uh, 4 years later, I can no longer sit up. I can take just a few steps using two walking sticks. I'm beginning to have brain fog. I've had trigeminal neuralgia already for 27 years, relentlessly worse. And it's very clear I'm destined to become bedridden by my illness, demented by my illness, and probably die with intractable pain. And that's when I discovered the Institute for Functional Medicine. I take your course on neuroprotection. I have a long list of supplements, which I'm happy to add. Then I had this really big aha. Like, what if I redesigned the paleo diet that I've been following already for 5 years based on this long list of supplements? And that's a bit more research. And with this very structured paleo diet, my fatigue is resolved, my brain fog is resolved, my physical therapist notes that I'm getting stronger. He's advancing my exercises, and we have added electrical stimulation of muscles, so we're advancing that as well. And I began walking with walking sticks, stunning my colleagues. And then a few months later, I ride my bike for the first time in 6 years around the block, which really changes how I think about disease and health. It will ultimately change the focus of the research that I do. And I have since made it my mission to teach clinicians how to use my concepts, to teach the public how to use my concepts. In my TED Talk has been viewed over 4 million times. So we're having a major impact. The research that, in my message, which was so condemned back in 2009, is now celebrated in the MS community, that I'm one of the leading innovators, leading MS dietary researchers.
Such a compelling story. And you mentioned you were doing all this research and you were implementing these interventions and seeing these massive improvements, but there was some skepticism and
Oh,
some
deep skepticism.
resistance. How did you overcome that? I mean, how did you stay
Well,
the course?
what is really helpful is that I'm sort of socially oblivious. So I just kept going where I was invited, and giving my lectures, publishing our research, in very low impact journals, progressively higher impact journals, and my research started getting cited and cited. We were presenting our research at scientific meetings, and now, most recently, I was at the Consortium of MS Centers, which has the scientists and the clinicians together. People were citing my research, and furthermore, they were also citing my books. So super interesting. It takes about 30 years to change the standard of care. I'm only 15 years into this, so I'm halfway there. My ideas are not quite so crazy. Certainly in another 10 years, I predict that the physicians in the autoimmune space and in the neurodegeneration space will be taught that diet, quality, stress management, sleep, exercise are just as vital as any FDA-approved drug treatments.
Hmm. In the early days, you were doing much of this research on your own. It sounds like, and kind of implementing these things in a stepwise fashion. And I'm interested to hear about the evolution of nutrition interventions.
Well,
And has your protocol changed based on what you've
um,
learned?
yes, at the very beginning, I implemented a very low-fat diet, very much like the Swank diet. Um, then I, had the mitochondrial theory. It was relying on supplements. Didn't really help. When I restructured my Paleolithic diet in a very specific way, that's really when a dramatic change happened remarkably quickly. And that's when I leaned into, yeah, supplements can be an important adjunct, but the whole lifestyle program with stress management, sleep, exercise, and very specific nutrition is vital. And now that we understand, or at least I understand, epigenetics more effectively and the microbiome more effectively, I realized that I was fixing my microbiome. I was also shifting my epigenetics in a very favorable way. It's the accumulation of all of those things that really led to this dramatic improvement.
Right. When we look at the nutrition piece specifically, much of your research uses kind of a modified paleo or a ketogenic diet,
Mhm.
but the theme is that there's a low carbohydrate intake. And I'm
Yeah,
wondering, is it the low carb itself that is the most helpful, or it's the addition of the other macronutrients, the higher fat, the
well,
moderate
so
protein?
I want to give your listeners a reference point. The standard American diet probably has about 300, 350 grams of carbohydrates. The Mediterranean diet cuts that down considerably to about 125 grams of carbohydrate. The modified paleo diet that I teach consistently has about 80 grams of carbohydrate. The medium chain triglyceride ketogenic diet would have 50 grams of carbohydrate. A olive oil ketogenic diet will have 35 grams of carbohydrate. You know, in a modified Atkins diet, a ketogenic style would have about 20 to 35 grams of carbohydrate. So the lower your carbohydrate, you're going to have more ketones in the bloodstream. It depends if you're using medium chain triglycerides, coconut oil, MCTs. You could probably get by with 50 grams of carbs, and that's easier for people to comply with. Um, I personally prefer the olive oil ketogenic diet because you get more olive oil. There's so many studies showing the benefits of olive oil for protecting the brain, protecting the heart, and even in a modified paleo with a bit more at 80 grams, you don't have as many ketones, but you still have a very favorable shift on your microbiome with any of those paleo to ketogenic diets.
Mm. I'm just wondering about the progression of, do you have patients who start out at a higher carbohydrate intake and then work to lower, or the other
Oh,
way
sure.
around?
So my first question when I'm dealing with my patients is, do you need a small next step that's everybody can do as a family, or are you ready for a really big uh, change that encompasses all aspects of your lifestyle because you have so much suffering, you're ready for a really big change? And I have people come to me who have severe suffering, and the whole family is ready for a great big change, and we will do that. Um, I also have families who are like, no, no, we have to do things bit by bit. And so then I may do much smaller changes. And for that family, I may take them from the standard American diet to a Mediterranean diet to a paleo diet. And depending on their response, we may stop at the paleo diet or we may continue to march them towards a ketogenic diet. I also will look at what are their metabolic health factors, if they have insulin resistance, um, metabolic syndrome, type 2 diabetes, severe obesity. I'll encourage them to go lower carb sooner because by improving all of those metabolic factors, we're also going to address, really protect their brain as well. So you really have to, but people will be vastly more successful if we do this as a family intervention. So a very critical part of the conversation is, what can you and your family do together?
Mhm.
And is your family on board with this? I want to have both adults that are in the household agree with what the plan is going to be and how they're going to approach their children. And then we can design the appropriate level plan. Now, I may have an opinion and tell them that given your overall health issues, I think a ketogenic diet will be where you want to end up. But that may not be where we start depending on these other factors.
Does that approach change for someone who maybe they have a family history of neurodegeneration and they want to do preventive versus someone who has a diagnosis already?
Well, certainly, if you already have issues with brain fog, cognitive decline, I really will be encouraging a ketogenic lower carb diet.
Hmm.
At the very least, I would like them to do the modified paleo diet, um, preferably a 50 grams of carbs or less. But for some, the modified paleo diet will be an easier starting point. If you go from the standard American diet straight to a 35-gram carb diet, we have to have some transition period to avoid that keto flu. Otherwise, that first couple weeks will be very, very difficult. And there are some things we can do to help reduce that with more salt, more light salt, more magnesium, taking supplemental ketone salts those first couple weeks. Um, but going from the standard American 350 grams of carbs down to 35 is very hard. And in our clinical trials, we put people through that, so we have to give them a lot of support as they transition from their standard American diet into a ketogenic diet.